This is Jeremy with Chiro Clarity, and in this video we'll be going over the ankle and the foot. Starting with the ankle, we'll see that we have the calcaneus, talus, navicular, cuboid, medial, lateral, and intermediate cuneiforms. An important bony projection off the calcaneus towards the medial aspect of the foot is this structure known as the sustentaculum tali. Looking at the metatarsals, we'll start to see some important distinctions from the metacarpals, although there are some similarities. The hallux, similar to the pollex, is where the first metatarsal belongs. Furthermore, the hallux only has a proximal and distal phalanx, just as the pollex only had a proximal and distal phalanx, and the pollex was where the first metacarpal belonged. Therefore, the metatarsals are labeled medial to lateral, whereas the metacarpals were labeled lateral to medial. Furthermore, each metatarsal and each phalanx of the foot have a base, shaft, and head. Base, shaft, and head. However, we'll see this bony projection off the fifth metatarsal, and this is known as the styloid process of the fifth metatarsal bone. Based off the bony anatomy of the metatarsals and the phalanges, we'll see that this specific structure is the head of the proximal phalanx of the fourth digit of the foot, whereas this structure is the base of the second metatarsal bone. In the foot, we have an interphalangeal joint, as well as our distal and proximal interphalangeal joints. However, instead of having metacarpal phalangeal joints, we'll have metatarsal phalangeal joints, MTPs. Similarly, we'll have tarsal metatarsal joints rather than carpal metacarpal joints, TMTs. And that gives a good general osseous overview of the ankle and the foot.